Hello, my name is Joanne Jones and I'm a registered dental hygienist. I'd like to take a couple of moments today with you to review the components of the extraoral examination. The head and neck examination is an integral part of the overall client assessment, which also involves the oral cancer screening. For this how-to segment today, we're going to review the components of the extraoral examination, being the examination of the temporal mandibular joint, the lymphatics of the head and neck, related to the submental, submandibular, the cervical chain, the supraclavicular nodes, the occipital, the postauricular, and the preauricular nodes. We've also examined the parotid glands and the thyroid gland. So let me now demonstrate how I would do a head and neck examination. So the first step in the extraoral examination is the assessment of the TMJ. So have you open and close, Taylor? Good. And open and move your jaw to the left and to the right. Good. I don't hear any clicking. Do you have any discomfort, Taylor, as I'm doing that?
Nope.
Okay, and I'm just going to check the parotid gland from the extraoral. Check for any swelling here. Great. Next, I'm going to do the examination of the lymph nodes. So we can use either a rolling stroke or almost like playing a piano, whatever is most comfortable for you. But what you want to do is to be able to position your fingers underneath the angle of the mandible so that we can do a comparison symmetrically from one side to the other. So we're going to start with the submental. And Taylor, I'm going to have you place your tongue in the roof of your mouth, please. Okay, that's good. And do that as you're viewing this segment too, so that you can relax it now, Taylor, so you can feel the difference on your own mouth and see how that feels. So we're going to be rolling here to check for any inflammation in the lymph nodes. Next, we're going to come down to the cervical chain here. And the sternocleidomastoid muscle is a thickening of the muscle here in the neck. It's good to have your client turn to the right. I'll have you turn to the right, and then you can palpate the deeper cervical nodes here and turn to the left, and then you can palpate on the opposite side, going down the whole chain here. And then I'm going to palpate the supraclavicular, which are right inside the hollow of the collarbone. And then moving back towards the posterior, we're going to come up to just below the occipital bone, and we're going to palpate that area. In most cases, you are not going to be able to define an enlarged node unless there is an area of inflammation or a premalignancy or something untoward happening. And now I'm palpating in the postauricular, and I'm going to move forward to the preauricular nodes. Okay, and the last area that we're going to assess is the thyroid gland. So you can have your client swallow for you when you're ready, and basically you can palpate from behind, or you can come forward and anteriorly position your fingers, sometimes a little bit easier from the position behind the client. I'll just have you swallow, Taylor. Good. And once more. Excellent. And what you're looking for, it is difficult to palpate the thyroid gland, but what you're looking for is symmetrical movement, that there's not an enlargement on one side or some type of irregularity in the movement, or basically the asymmetry in the movement. Thank you very much, Taylor.